In today's Social Security update, the Senate is giving seniors a $6,000 gift. This is significantly higher than what the House of Representatives has proposed, which was $4,000 as part of the big, beautiful bill. Now, it shows that Congress is really trying to help seniors address the rising cost of inflation and the burden that seniors are facing with increased groceries, transportation, prescription drugs, etc. But here's the question that I have. How does this $6,000 affect seniors that are on low income? Do seniors that are on disability, especially SSI and SSDI, do they qualify for this Senate tax deduction? And you may know that President Trump had promised that he was not going to make seniors pay taxes on Social Security. Well, that promise went out the window, and now they are replacing it with this tax deduction. Well, here's the thing though, tax deduction work in different ways than tax credits. And so what I want to talk about today is how this is going to impact low income seniors who is eligible for this $6,000 gift from the Senate, and how is it going to impact your bottom line. My name is Kwame Kwade. I am a government benefits expert. For 15 years. We've been creating content to help seniors get the retirement benefits they deserve. We create content on Social Security, Medicare, Medicaid, food stamps, and any personal finance issue that affects seniors. If you are new here, welcome. I want you to do me a favor, go into the comment section and let me know your city and your state. So let's dive in into this breaking news out of the Senate, which is doing something significantly better than the House of Representatives have done with the big, beautiful bill. So here is the details. The Senate is offering a $6,000 additional standard deduction for seniors age 65 plus. And to be eligible, you have to be 65 or older and meet certain income limits. So you have to make up to $75,000 for single filers and $150,000 for married couples that are filing jointly. Now, the deduction will phase out over a certain period of time. And here's an important thing you need to know. If this passes, it's only going to last from tax years 2025 to 2028. And the deduction is supposed to be on top of the standard deduction that already applies to seniors. Now, here's an important thing you need to know. This is a tax deduction, not a tax credit. Now, you're probably wondering, what is the difference? Well, a tax deduction reduces your taxable income, while a tax credit directly reduces how much taxes you pay. So currently, this is part of the big, beautiful bill that President Trump has been talking about and has been passed by the House of Representatives. And I've talked about this a lot. I don't think the House bill did much for seniors. And when I look into this Senate bill, even though I'm seeing this $6,000 deduction, I still do not see help for low income seniors. And here's the thing. If you are a senior and you are on fixed income and you don't have any other income other than your Social Security benefits, you're probably not paying any income tax to begin with. So if Social Security is your only source of income and you're not paying taxes, this $6,000 does not do anything for you because there is no taxable income to begin with. So this proposal, while it is all over the news everywhere, it is going to help about 40% of seniors. So what happens to the 60% of seniors that are on fixed income that do not make enough Social Security income to pay taxes? How about people on disability benefits? How about low income seniors in general? And that's what I want to talk about. So the matter of fact that we all know right now is that seniors are struggling. And there are many reasons why seniors are struggling in 2025. The first reason is insufficient income. The average senior on Social Security is making $1,905, but that's the average. A lot of seniors are making way less. I have seen people report that they make about $900 or $1,000 in Social Security benefits, which is way below the poverty level. And 39% of seniors depend on Social Security as their only source of income. But with low Social Security income, on the other side of it is Medicare. Medicare is crushing seniors this year. While Social Security income or cost of living adjustment went up by 2.5%, Medicare premium Part B went up by 6.6%. On top of that, this year, 2025, the average senior is expected to spend $6,663 on Medicare out-of-pocket costs, deductibles, co-pays, and all other things that you have to pay as part of just getting healthcare as a senior. So on one hand, you have low cost of living adjustment, which was about $50 increase per month, but then you are staring at a $6,000 out-of-pocket cost to just handle Medicare costs in addition to your premium that you're paying. And then the other thing we can all agree is that inflation has really wiped out a good chunk of seniors' income over the last 10 years. And the data shows that seniors have lost 20% of their purchasing power due to inflation. It means that cost of living adjustment has not caught up with inflation. So that is the second area that seniors are struggling. Food prices have gone up, prescription drugs, healthcare, transportation, rent, mortgages, utilities, everything has gone up. And, you know, how are seniors supposed to deal with this when you have a $50 increase in your Social Security check the entire year? So this tax deduction, while it may look good on paper, does not help majority of seniors. The other place that seniors are struggling is that, if the average senior needs the average senior needs $2,900 to live. If you don't have a mortgage and you're a senior citizen in the United States right now, the average amount of money you need is $2,900, but the average Social Security is $1,900. So there's $1,000 gap. Where are seniors getting this money from? Well, they're piling on debt. And more than ever before, seniors are way over their head regarding debt. The average senior owes medium debt is $34,000, and 65% of senior households are in debt. And the medium debt is $34,000. On top of that, you layer on the fear around Social Security. I did a recent video that talked about the fact that the government Social Security Trust Fund, the Social Security trustees came out just this week of June the 20th. They came out and said that there's going to be automatic cuts to Social Security in 8 years because the Social Security Trust Fund is going to run out of money sooner than they thought. So on top of everything that I've talked about how seniors are struggling, the Social Security Trust Fund is also going to run out of money sooner than they thought, which is going to lead up to a 25% cut in Social Security benefits on top of everything that's happening. So when you look at all that, a $6,000 tax deduction does not really do anything. So let's talk about what they can put in that big, beautiful bill that can really help seniors in real time, but also in a meaningful way that puts money in their pocket. The first thing they can do is to pass the Social Security Expansion Act. That was supposed to increase Social Security benefits and disability benefits across the board by $200 a month. That is $2,400 a year. Now, that may not be much, but it actually helps close the gap. The inflation gap that has slowly eaten the income of seniors over the last few years. Because this year you got only a $50 increase. So a $200 increase at least helps slow that gap down. And that is the Social Security Expansion Act. And Congress can pay for it by removing the cap on Social Security. Right now, if you make up to $176,000, you pay Social Security taxes on your income. Any income after that, you don't have to pay Social Security taxes. So if you make $1 million, you only pay Social Security taxes on $176,100. If they remove that cap, not only are they going to save Social Security for 75 years, they can also put $200, at least $200 increase in Social Security benefits for every senior today. That is the number one thing they can do right now. The second thing is to increase the minimum Social Security benefit that seniors can receive. And everything that I'm talking about right now are proposals that Congress have seen, the president has seen, and they can do something about it. The second thing they can do is increase the minimum Social Security benefits that seniors get. There are a lot of seniors that are living in poverty because Social Security is their only source of income, and they are getting about $1,000 or even less than $1,000. If you're getting $1,000 a month in Social Security, that's $12,000 a year. That is below poverty. Now, I am not the one that is telling you that. The government is telling you that because the government each year comes up with the poverty level that is used to get government benefits. So if you apply for food stamps, if you apply for heating and cooling help with your utility bills, all these government assistance programs are they qualify you based on where you fall with the federal poverty level. If you're making $12,000 a year in Social Security benefits, you are way below the federal poverty level. So the idea is to increase the minimum benefit that any senior that has qualified for Social Security, regardless of how much they paid into the system, can get. Because a lot of seniors work 30, 40 years. They paid into the system, but they work in low-wage jobs. And so did not contribute a lot of money into the system and now are retiring and have to depend on Social Security. They're getting the bare minimum and can barely make it. If you increase the minimum to 125% of the federal poverty level, which will give each senior at least $1,500. I mean, $1,600 based on today's calculation. That then moves a lot of people out of poverty and gives them an extra $500-$600 boost in their Social Security check. That will make a real difference. The $6,000 tax credit, it's not going to help those people who are getting $1,000 a month in Social Security because they don't make enough money to even pay taxes on Social Security to even get relief on Social Security taxes. And then the third thing they can do is to change the way the cost of living adjustment is calculated. Currently, you may not know this, but Social Security cost of living is calculated using what they call the Consumer Price Index for urban wage earners and clerical workers. It is a government term to say that they are looking at price changes that affect urban wage earners and clerical workers. Well, the first thing is that a lot of seniors, the people that are on Social Security, are not urban wage earners and clerical workers. Second, there are a lot of seniors that live in the rural areas that get impacted by different kinds of costs that urban clerical workers are not dealing with. And then there are unique set of costs that seniors at a certain age have to deal with that people that are working in the urban areas do not have to face. Prescription drug increases, medical treatment, long-term care, all these things that are happening that people don't have to deal with at that age. So to use that to calculate cost of living adjustment for seniors is one of the reasons why Social Security income has not kept up with inflation or true inflation that seniors are facing. So to fix that, it's been suggested, and Congress have seen this. It's been a bill. There's been two bills, one in the Senate, one in the House, to deal with this, and it's to set up a new cost of living adjustment that will focus on seniors and their cost and price changes that affect seniors, so that when the government calculates Social Security cost of living adjustment, it would truly reflect the cost that seniors are facing on a day-to-day basis. That will be the third thing that they can put in the big, beautiful bill that can really change the lives of seniors today versus a tax deduction that does nothing for a majority of seniors. And then another thing that they can do if they really want to help seniors is to do something about the Social Security Administration taking 50% of checks from Social Security beneficiaries and disability beneficiaries if they get into an overpayment situation. You may have heard that it used to be 10%. If you owe the Social Security Administration money because you collect Social Security before your full retirement age and you were working and you did not report all your income, or you reported your income and they did not get around to documenting that and making the appropriate adjustments, and then all of a sudden you get a bill for $20,000, $30,000, $40,000, and you're supposed to pay it Even if they made the mistake, you are still on the hook for it. So it used to be that they would take 10% of your Social Security check to pay that money back until it's paid off. Well, they changed the rule to 100%, got a lot of blowback or pushback, and then they settled on 50%. But 50% of Social Security check that goes to a senior citizen is still a lot of money to take away. So if they want to do something, they can return the the Social Security overpayment collection amount to 10%. What it was before, they bumped it up this year. And then finally, if they want to help seniors in a real way, they can expand the SSI program. Supplemental Security Income provides additional support to the poorest seniors, but eligibility is very limited. So expanding SSI will increase benefit amounts for seniors who are on low income to be able to get an additional source of income. And here's the thing. If you are on Social Security and you're low income and you're getting SSI, sometimes the SSI can help you pay for your Medicare premiums. So there's a lot of benefits there. Or you are on Social Security and on Medicaid and Medicare, then your Medicaid can help pay for that. So there's a lot of ways to get extra income to be able to help with your cost. And expanding SSI is one of the ways that the government can help provide additional money to seniors so that they can get extra help in the rising cost of living that seniors have been facing. So that is what I think Congress should do. Now, I want your opinion. Let me know what you think. Do you think the $6,000 tax deduction is a great idea? Or do you think they should go further in the big, beautiful bill and really provide meaningful help to seniors that is desperately needed? So if you like what you heard, I want you to hit the like button, hit the subscribe button, share this video with somebody that you know needs to hear this message or needs to understand what's happening with the big, beautiful bill and how it's going to impact their income. And before I go, I want to talk about Medicare. Every video that I record, I want to remind you that we have a great partner, Chapter Medicare, that can really help you get into a better Medicare plan. If you're currently on a Medicare plan and you don't like it, or you're not even sure whether there's a better plan, well, there is. But here's the thing, 90% of all seniors are in the wrong Medicare plan. Why? Because it gets overwhelming. You have 24,000 plans, and some plans are location specific. So you have to figure out which plans are in your area that you're eligible for, what the copays are, what hospitals are in that network, what doctors, whether your doctor is living in the network or all the doctors that you see are in that network. And does it fit your budget? How does it compare to traditional Medicare? All those decisions have to be made. And a lot of seniors get overwhelmed and they just pick the closest thing they know, or somebody is on a particular plan and then they just pick that. Well, it's good until you go to the hospital or you need care and you realize that it doesn't cover what you need. So Chapter Medicare exists to help you understand Medicare, pick the best plan for you that meets your need, and they can save you $1,100 a year. The service is free, but you have to act soon because there may be a very small window for you to be able to switch to a better plan. And if you're turning 65, you have that 7-month window to make a decision. And if you're so confused, Chapter can help you. So call the number on the screen, 539-205-2147. These guys are A+ rated with the Better Business Bureau. There's tons of 5-star reviews that you can go online and read. And every person we have sent them have had nothing but a good experience because they are not there to push you into plans that make them the most money. Actually, they don't even pay their agents to push specific plans. Their goal is to get you into the plan that fits your need and saves you money. So call Chapter today on the number on the screen or go into the description to this video and fill out the form. There's going to be a form that you can fill out. It's very short, a few questions, and then they will reach out to you and help you get you into the best Medicare plan, but also help you avoid being one of the 90% of seniors that are in the wrong Medicare plan. And lastly, I need you guys to sign up for our newsletter. Why is that important? Well, if you go into our YouTube page, on the page in the description, there's a link to our newsletter. It includes tons of information that you don't want to miss. Senior discounts, senior financial assistance, breaking news, anything in and out of Congress that's happening that could affect your Social Security, Medicare, Medicaid, food stamps. It's all in there. And useful information that seniors need to know that is not presented on every video, because we can only put so much on a video. We put all of that in the newsletter. So sign up for our newsletter, or you can go to benefitsinsider.co/subscribe and sign up today. So until I see you tomorrow, thank you for watching.